I have always wanted to become a nurse. It was a dream of mine since I was younger.
I went to West Africa while I was a freshman in college and was volunteering at a clinic, and it was a nursing internship, so I fell in love with that and knew I wanted to do that for the rest of my life.
I think taking care of patients is a great calling. I'm not sure if it chose me or I chose it. One of the most trusted, respected professions that we have.
I am originally from Minnesota, but I knew I loved Southeast Alaska. I had visited a couple years ago.
Alaska is an incredibly beautiful state, Juneau in particular. There's so much wildlife and beauty every day. It's a beautiful drive to work. You can't not have fun in Juneau with over 200 miles of hiking trails. You can kayak, you can ride your bike, you can watch the whales, you can go fishing, you can go camping. The operating room in general has always been my passion. One of the biggest reasons that I became a nurse is, for patients to feel comfortable when they're at their worst and when they're most vulnerable.
I have been a nurse for 5.5 years.
Graduated nursing school in May of 2016, so I guess just a little bit over a year.
38 years.
I grew up in Petersburg. My husband grew up in Sitka. I know a lot of the patients that come through. I know a lot of Juneau patients, and it's comforting to those patients to know that I'm their nurse and I'm taking care of them.
When they come to us, they are in need of surgical care, and we are here to provide that safe quality of care for them. I think that they put a lot of faith and trust in us. And from the most feedback that I get, we provide very good care. And at the beginning, when they come into the room and pre-op, we're verifying that the patient is getting the correct procedure on the correct part with the correct surgeon. So then when they come in, it's very focused on making them feel very comfortable, because at that point they're very vulnerable. They don't know us, and they're trusting us.
While the surgery is going on, we are the patient's advocate because they are asleep.
As a surgeon at Bartlett Hospital since 2003, I've had the opportunity to work with many different nurses in the operating room. The nurses treat patients not like a number, which is sometimes the case in a big hospital, but like family, like neighbors, because oftentimes they are neighbors. So the level of care and attention, I think, is excellent.
I love working with the people I work with. I believe we have an outstanding team.
We have excellent surgeons, anesthesia providers. We have a great group of nurses, circulating nurses, and scrub techs. We have a great housekeeper. We have very well-trained people in our central sterile. We are like a big family.
The way we interact with one another, our rapport, and our friendships that go outside of work make it a great, fun environment here.
I am Leanne. I'm a Bartlett OR nurse.
I am Eric, and I am a Bartlett OR nurse.
My name is Sherry. I'm definitely a Bartlett OR nurse, and I also happen to be the director here, and it's a great privilege of mine.